Hi guys, I'm Dr. Siraj Ahmad, your faculty of pharmacology, and now I'll be discussing the recall of pharmacology that was asked in the recent examination. All this topic that we are going to discuss can be a very potential MCQ in the upcoming examination as well. Do remember that this examination has become totally integrated clinical pattern. So saying that this particular question was only from one subject will be a little difficult because one question had some information about micro and then they asked about pharma. Likewise, there were a lot of integration that we have seen in this examination. That is why we had a lot of difficulty as well, and many students had different version as per what they could recall, because these are all recall based session that we have. So as per whatever they recall, whatever topic that they could recall, we are going to discuss all those topic here. And a quick disclaimer to all of you guys that this is not something that I would say that the exact exam question that we had, but we try to come up with the best version of the recall that we could hear in this examination. So let's go and start this session. Feel free to comment in between if you feel that some option was not there or some option should be changed, or it's discussed in other way around. So please feel free to comment in the comment section, in the live chat option. I'll try to interact with you through chat option as well. Okay, so let's get started. And the very first question that I'll be discussing with all of you guys is: elderly male with 2 bottles of alcohol from a local liquor shop, and after consuming he developed symptoms like ataxia, drowsiness, blurring of vision. Which of the following is preferred? Now local liquor shop, definitely they are talking about a condition known as your methanol poisoning, right? Methanol poisoning. So methanol poisoning or ethylene glycol poisoning, what is the drug of choice that we have discussed with all of you guys? We are having fomepizole as an antidote of choice. Fomepizole as an antidote of choice. Now what is fomepizole? In next examination they can ask you fomepizole. It is one of the alcohol dehydrogenase inhibitor. Alcohol dehydrogenase inhibitor. A point to remember here that fomepizole being an alcohol dehydrogenase inhibitor, until it was not there, we had another antidote that we were using by ethyl alcohol. Now some students are telling, sir, fomepizole was not in the option, only ethyl alcohol was there, and some students are saying nahi, dono option mein tha. Now that is why I'm just putting a quick disclaimer that this is not something that I say that this is the exact question that was there. Please feel free to go ahead and choose whether you mark ethyl alcohol or fomepizole. अगर fomepizole था आपके पेपर में तो definitely fomepizole will be the answer, period. इसमें कोई and if but नहीं है. But if fomepizole was not there and if you think that you have marked ethyl alcohol, so other alternative that we have is ethyl alcohol. So ethyl alcohol, what it will do? Ethyl alcohol, it is considered as a competitive inhibitor of alcohol metabolism. So methanol ka jo enzyme hai, that is alcohol dehydrogenase, they will all be shifted towards the ethyl alcohol metabolism. Therefore the risk of toxicity or the fatal outcome that was there with the methanol will be reduced, है ना. So ऐसा नहीं कि ethyl alcohol is a very helpful, है ना. Do remember both of them are alcohol, but एक का toxicity ज़्यादा, एक का toxicity कम है. I mean in this scenario, so we have a specific antidote known as your fomepizole. So in single line, if I have to say methanol poisoning or ethylene glycol poisoning, ethylene glycol that has been asked in one of the examination, ethylene glycol in one of the EPSC examination, that a patient is coming after drinking coolant of a car, है ना. So I think all of you guys have got this one. Naloxone is the antidote of opioid. Flumazenil is the antidote of benzodiazepine. So don't need to mug it up. All of you guys are already aware. Which of the following agent is preferred in the treatment of benzodiazepine? So again, benzodiazepine overdose के लिए क्या prefer करेंगे? Benzodiazepine के लिए we are having a flumazenil. It's an antagonist. It is considered as a antagonist of benzodiazepine, है ना. Benzodiazepine के लिए flumazenil is the antidote, है ना. Folinic acid will be added with the methotrexate. Naloxone again is the antidote for opioid, and fomepizole again is something that we'll be preferring in methanol or ethylene glycol poisoning. Now do remember a very important thing. In the very beginning when we were discussing general pharma and also when we were discussing the rapid revision session, remember I gave you a table and I told you that in 2021 नीट पीजी में 5 क्वेश्चन आए थे उस टेबल से. आपके एग्जाम में 5 नहीं आए थे, 3 आए थे from one single table. What was the table? I'll give you the table. Like first and foremost, let us finish this question and then we'll talk about the next one. Thalassemia patient with a history of multiple blood transfusion brought with a chronic iron overload. Now which of the following is the oral drug that will be preferred for managing the symptom? Now oral drug for preferred. Now see, iron poisoning मैंने बताया था 2 तरह के patient होंगे. One patient will be emergency condition, and in emergency we are going to prefer a drug that is your desferrioxamine. Now desferrioxamine, what is the root of desferrioxamine? It's an injectable agent. ठीक है. Now oral agent, if they are going to ask you, we are having two important oral agent. One is deferriprone, that is oral, and other one is known as your deferrasirox, right? These two agents are oral agent. So we have already deferriprone, that will be the preferred agent. So कोई भी hemolytic anemia है, if there is a recurrent blood transfusion, there will be risk of iron overload. Iron overload will be there, and therefore you can give oral iron chelator agent. They are what? Iron chelator agent, oral iron chelator agent. ठीक है. विच वन इज आयरन चिलेटर एजेंट? बोथ डेफेरिप्रोन, डेस्पिरोक्सामिन. 2021-2022 में जो क्वेश्चन आया था नीट पीजी, दे आस्क्ड दैट अ चाइल्ड वाज प्लेइंग एंड ही कंज्यूम्ड सम टैबलेट एंड देयर वाज एम्प्टी बॉटल ऑफ आयरन दैट वाज फाउंड अराउंड हिम. व्हाट विल बी द एंटीडोट, है ना? सो नाउ डेफेरिप्रोन हियर इन दिस केस सिनेरियो, बिकॉज इट्स अ ओरल दे आर आस्किंग. ओके. Now vitamin B12 deficiency, or if the patient is having megaloblastic anemia, EDTA, BAL, we can use them in lead poisoning. D-penicillamine is something that will be used in a copper poisoning. है ना? Now, as I was telling to all of you guys that we will be copper poisoning or copper chelator. It's a copper chelator agent. Let us quickly discuss the table that I was talking about. Now this is one table from where questions are very frequently asked, and in this examination of FMGE we got 3 questions from one, and this table was discussed in rapid revision as well, and we also have discussed in general pharma section of our regular class also. Okay, so atropine का antidote क्या होगा? The antidote of atropine, it is going to be physostigmine. What is atropine? Atropine is a non-selective muscarinic antagonist. Morphine के लिए क्या है? That is going to be your naloxone. Morphine के लिए we have naloxone. Copper, the chelating agent will be D-penicillamine, right? D-penicillamine, it's a copper chelating agent. Okay, next that we are having is one more iron. As I told you that we have desferrioxamine अगर emergency है तो desferrioxamine if there is emergency. However, we are having some oral preparation as well. Oral preparation we have deferriprone, and other one is known as your deferrasirox. So all these questions are already discussed a couple of times. In fact, when there was a MCQ ABKI BAAR 200 PAAR, in that also we discussed this one, all the antidotes. Lead poisoning में we can use EDTA, we can also use BAL. Paracetamol poisoning में we can use N-acetylcysteine. This question was also asked in the PYQ, I mean last year. Digoxin में we will be using Digibind, it's a chelator of digoxin. Benzodiazepine poisoning में flumazenil. So was it asked? Yes, flumazenil. Now in upcoming examination they might remove benzodiazepine and they can give you barbiturate. So for the barbiturate, remember we are going to do forced alkaline diuresis, है ना? Forced alkaline diuresis, right? Acidic drug के लिए we use forced alkaline diuresis. All right. Then beta blocker के लिए we have glucagon. Benzodiazepine poison के लिए we will be using flumazenil, right? So this is one table from where questions are frequently asked, and you can also be ready for the upcoming examination as well, and make sure that you are going to revise all this, right? Now let us see the next question quickly. A female with the history of HIV positive, not taking any antiretroviral therapy, delivered a baby. What should be the initial treatment that should be started immediately to the newborn? Now there were again few controversies. Few students were telling other way around, but after discussing with many students, we come up with this conclusion that this will be the final version of this question. Now whenever there is a mother to child transmission के लिए prophylaxis के लिए we are having the agent that is nevirapine. We always use nevirapine suspension format 2 mg per kg for a total duration of 6 weeks. ठीक है. After 6 weeks you can after 6 weeks, or they usually say that confirmation of the diagnosis will usually be done after 18 months, and then only you will be starting other drugs. Now right now if you want to start a prophylactic agent because you are not very sure whether this baby has acquired or not, because the risk of transmission in HIV, what is the risk of transmission, ROT in HIV, risk of transmission कितना है? Very less. That is your 0.3% risk is there in the needle prick. In the needle prick 0.3%. है ना. मदर टू चाइल्ड ट्रांसमिशन में देयर आर मेनी डेटास एंड सम ऑफ देम आर misleading as well, but on an average we see that okay, if there is a pregnant female, there is high risk, है ना. High risk sometimes some studies are telling 25, some studies are telling 30, but needle prick में around 0.3%, right. Now mother to child transmission में usually क्या होता है, मदर को हम क्या देते हैं, एंटी रेट्रोवायरल ड्रग्स देते हैं, है ना. Now if the patient is not taking anti retroviral drug, in that case scenario also we will be proceeding with the nevirapine to the newborn as soon as the baby is born, and it is also said that if there is a pregnancy, in the pregnancy, if the person is a female is diagnosed with HIV, you should start the antiretroviral therapy as soon as it is diagnosed. You do not wait for CD4 count now. Okay. For prevention we are having two drugs. Remember, zidovudine is also one of the drug, but the preferred one is always going to be nevirapine. In fact in our country as well, there is a list of essential medicine, उसमें दो ड्रग दिया गया है for the prophylaxis, zidovudine और nevirapine का discussion हुआ है. Nevirapine is always preferred. Cost is one reason, easy availability is one reason, less side effect is the other reason. Okay. A newer drug bedaquiline, multiple time I have discussed this question with all of you guys. Bedaquiline को याद रखना है, B से bedaquiline, it is one of the ATP synthase inhibitor. Now in the examination what they did not give the term ATP, they give the full form of ATP, है ना. So adenosine triphosphate synthase inhibitor of the mycobacteria. Yes, DNA dependent RNA polymerase inhibitor, this will be the mechanism of action of rifampicin. Arabinosyl transferase will be inhibited by ethambutol. Catalase peroxidase is the enzyme that is required for the activation of isoniazid. If there is any mutation in the catalase peroxidase, isoniazid will not be activated. So catalase peroxidase mutation is mainly responsible for the isoniazid resistance. So right now all of you guys are already aware of bedaquiline. Now delamanid, you check out any of the review class that we have discussed. We have discussed it. Delamanid, pretomanid. Now what have I told you? Manid and manid, है ना. मैंने बताया था आपको manid and manid, दोनों ही manid है. Manid and manid, जो manid है, they both are actually mycolic acid synthesis inhibitor. Mycolic acid synthesis inhibitor. Same as your isoniazid, that is also one of the mycolic acid synthesis inhibitor. Delamanid is also a mycolic acid synthesis inhibitor. Bedaquiline B से bedaquiline B और ATP synthase inhibitor. So energy production in the mycobacterium will be compromised. All right. Now next time what they can ask you, potential MCQ इसके साथ discuss कर लेते हैं, इसके important side effect. So bedaquiline जो है, it's a drug that is mainly approved for the MDR tuberculosis and also can be used in XDR-TB, because XDR-TB जो B-Pol regimen है, B-Pol regimen, so bedaquiline, pretomanid and linezolid. So इसके important side effect they can ask. Important side effect, they are highly cardiotoxic agent, and the cardiotoxicity they mainly causes QT prolongation. They are also hepatotoxic agent. They also can lead to electrolyte imbalance. So examiner asks that what are the important lab parameters that you should keep an eye on. So now you have the answer already: ECG, LFT, and electrolyte parameters. You should always keep an eye on all these parameters, right? So we'll go ahead with the next question. A 30-year female brought by her husband. Now there was a history of depression. Now this history has been distorted by many students and by many people. Different version has been given, but we have come up with one of the version that suits best. He just try to understand the concept that there is a female had a depression, diagnosed with major depressive disorder. She was accompanied by her husband. She was started on an antidepressant, and after starting the antidepressant, she developed some symptom of insomnia, restlessness, agitation, anxiety, diarrhea, headache. Now some of these symptoms may not be there, but students clearly they recall that agitation or restlessness था सर insomnia भी था, हेडेक, डायरिया, एंजाइटी. आप देख लो अगर है तो, अगर इतना आ रहा है एंटी डिप्रेसेंट देने के बाद से, तो विच ड्रग इज पॉसिबली शी वाज स्टार्टेड. नाउ मेजर डिप्रेसिव डिसऑर्डर में which drug can cause this one? Now do you guys know that I always used to discuss the important side effect of SSRI, side effect of selective serotonin reuptake inhibitor is SSRI, और SSRI को क्या बोलता हूं मैं? S stand for your serotonin syndrome. So because of excessive serotonin, the patient will have nausea, vomiting, diarrhea, anxiety, agitation. ये सारे के सारे आएंगे. Anxiety, agitation, restlessness, ये सारे के सारे आएंगे. And diarrhea will be very, very predominant. There will also be blood pressure, BP fluctuation will also be one of the problem with this serotonin. And a vivid dreams, एक बार पहले एम्स में पूछा हुआ है, vivid dreams is also something that has been asked in the aims. Then sexual dysfunction in the 2021 examination, sexual dysfunction was something that was asked. Now sexual dysfunction may they will be causing delayed ejaculation. Because of the delayed ejaculation, this happened to be a good news for some people, because it was, it got FDA approval for premature ejaculation. It got FDA approval for premature ejaculation, so that's very good news, है ना? So delayed ejaculation, anorgasmia is something else that was mentioned. That is one of the side effects. R stands for your restlessness and insomnia. Now please do remember this one, that SSRI ka side effect will be remembered by the very, very simple mnemonic of SSRI. Now after giving which of the following drug the patient developed this one. Now which one is SSRI? The only one in the list that is SSRI is fluoxetine. Citalopram, fluoxamine, है ना? The only one in the list is fluoxetine. Buspirone is the anti-anxiety drug. Buspirone ये काम नहीं करेगा. Haloperidol is antipsychotic drug. It will mainly associated with your extrapyramidal symptom. Lithium is a drug for mania, है ना? Mania के लिए drug of choice है. It can cause renal toxicity, it can cause leukocytosis, it can cause tremors. वो सारे symptom cause करेगा, है ना? तो fluoxetine is the correct answer. I hope this question is there in the best shape that we could get, and all of you guys are satisfied with the version that we got here. Okay, now next question. There is a 70-year-old patient was brought to the OPD with complaints of urinary hesitancy and incomplete urination. Incomplete urination, or they say, the patient is not satisfied, and he feels that the urge to urination is still there after some time. So USG also shows there is a prostate enlargement and residual urine volume of around 130 ml. So this is clearly a case of benign prostatic hypertrophy. And in BPH, we always use some of the important agent. One is known as your 5-alpha reductase inhibitor. Now 5-alpha reductase inhibitor, it inhibits the activation of testosterone to dihydrotestosterone. ठीक है, डाइहाइड्रोटेस्टोस्टेरोन में कन्वर्ट नहीं होता है, विच इज द एक्टिव फॉर्म विच इज इन्वॉल्व मेनली इन द एनलार्जमेंट ऑफ द प्रोस्टेट ग्लैंड. सो अल्टीमेटली क्या होता है, द ग्लैंड का साइज भी इसके थ्रू कम होता है ना. 5-alpha reductase inhibitor we can use. We can also use alpha 1 blocker, like for example prazosin, terazocin तो ड्रग ऑफ चॉइस है अगर बीपीएच के साथ हाइपरटेंशन आ जाए, है ना. सो बिनाइन प्रोस्टेटिक हाइपरट्रोफी विद हाइपरटेंशन, this will be the drug of choice, है ना. Now given the option that we have in a BPH, are you going to use ACE inhibitor, aldosterone receptor antagonist, calcium channel blocker, or 5-alpha reductase? I think it's needless for me to say anything. All of you guys are already aware, है ना. So instead of asking which of the following drug can be used in BPH, they gave a scenario. So आपका क्लिनिकल क्वेश्चन ऐसा नहीं कि बहुत डिफिकल्ट है. इंस्टेड ऑफ सेइंग which of the following drug can cause the shown side effect, they are going to give you a clinical question, and this is exactly what we have been harping ever since 2018-19 कि बच्चों आपके एग्जाम में क्लिनिकल बेस्ड क्वेश्चन होंगे, and examiner is not preparing today. It has been coming from 18-19. You check out any video of 18-19, and we are telling at that time as well that okay, your examination has, or your subject has become a clinical pharmacology, and expect clinical based question. So simplest of the question are in clinical base. Okay, let's see the next one. 44-year-old patient with the HIV positive presents to OPD with complaints of blurred vision, floaters in the eye. Now this can be a very good integrated question with ophthalmology. You check out one session where me and Dr. Shashwat Ray sir have conducted a session, ऑफ्था और फार्मा इंटीग्रेशन. एग्जैक्टली सिमिलर काइंड ऑफ क्वेश्चन वी हैव गिवन विद द इमेज. यूट्यूब में है फ्रीली, काफी 2-2.5 महीने पहले किया था, आप चेक कर सकते हैं ना. सो सीएमवी रेटिनाइटिस का डायग्नोसिस भी दे दिया, पिज्जा पाई रेटिनोपैथी, कॉटन वुल spot on the retina. What is the diagnosis? CMV retinitis, and the drug of choice will be ganciclovir. So we prefer one more pro drug, that is valganciclovir. तो ये भी डायरेक्टली डिस्कस्ड क्वेश्चन है. Valganciclovir, it's the pro drug that can also be used. Other that can be used will also be cidofovir can also be used, and foscarnet is something that can also be used. What cannot be used, that was asked in 2016 FMG. PYQ check करिएगा. What will not be used in CMV? Not for CMV. This was asked already. Not for CMV. And option is acyclovir. Remember, acyclovir will not be used in CMV. It has no efficacy. But cidofovir, foscarnet, ganciclovir, and ganciclovir can be used. Ganciclovir is the drug of choice. We do not have any role of cotrimoxazole or tenofovir. Tenofovir is an antiretroviral drug that can also be used in hepatitis B. Okay, so I hope all of you guys are okay here and all of you guys have made correct. Ganciclovir, CMV retinitis. That's a very simple one. Next one. This is the list of drugs that will be used. Ganciclovir implant, and IV ganciclovir, well ganciclovir, and cidofovir you can use, foscarnet you can use. So these are the drugs that can be used. Examiner is not expecting from you to remember the doses exactly, है ना, बट जहाँ कहीं भी important है, जैसे कि कुछ important areas जैसे कि TB, malaria, leprosy, वहाँ पे we used to discuss the doses. However, in this examination they ask medicine का question integrated with pharma, where they have discussed what will be the dose of steroid in a certain condition, है ना, तो वो मैं डिस्कस करूंगा अभी. नेक्स्ट वन, फीमेल पेशेंट विद हिस्ट्री ऑफ पोस्टपार्टम हेमरेज वर ट्रीटेड विद ऑक्सीटोसिन और एर्गोमेट्रिन. Postpartum hemorrhage, what is the drug of choice? First and foremost, the drug of choice, it is going to be what? It is going to be oxytocin. Now here whether doses were given or not, I am not very sure. Some students said sir कुछ dose था, some students said नहीं simple drug था. Now अगर dose था तो again do remember, आपको उस पे ध्यान नहीं देना. ध्यान क्या देना, क्वेश्चन का लैंग्वेज सुनिएगा. They have already given oxytocin and ergometrin. Oxytocin is the drug of choice, followed by ergometrin, that is the next alternative that we have. But even after two drugs, they are not able to stop. The next line, the next preferred agent that we have is a carboprost that happens to be PGF2 alpha analog. PGF2 alpha analog. This will be causing uterine contraction, है ना, ये uterine का contraction कराएंगे, so that the vessel could be constricted. The vessel could be constricted because the vessel is there in the crisscross fraction of the myometrium. So carboprost is something that can be used. Now can we use dinoprost? No. Dinoprostone is something that can be used. Yes. Can we use misoprostol? Yes. Misoprostol can also be used, but since this is an emergency scenario, oral पे rely नहीं करेंगे. We'll be preferring either per rectal route वाला or injectable route वाला. Right now, carboprost is something that will be preferred in this case scenario, and this is the list of the drug that will be mainly preferred for the treatment of the postpartum hemorrhage. So with the doses, oxytocin 10 to 40 units, and methyl ergonovine or methergine, that's the same thing that they have mentioned as well. Ergometrin, that's the same thing, उसी का derivative है ना. If it is not responsive, then we will go ahead with the next line. So that is going to be PGF2 alpha analog. देखिए PGF2 alpha analog. Carboprost is something to PGF2 alpha. Later on, we can use dinoprostone. As I said, dinoprostone we will be using, that is PGE2 analog, or misoprostol. Misoprostol is something that can also be used. So 1000 microgram per rectal preparation is something that can also be utilized for the uterine contraction. Uterine atoning हो गया तो postpartum hemorrhage है ना. Postpartum hemorrhage को prevent करने के लिए we will be giving oxytocin or we will be giving ergometrin. If not responsive, we can give PGF2 alpha analog. ठीक है. And in the January 2023, what they asked, that in a patient with the history of bronchial asthma, which of the following drug will not be used? So carboprost वहाँ पे था. So carboprost will also be associated with bronchoconstriction. Therefore, they should be contraindicated in patients with history of bronchial asthma. With the history of bronchial asthma, they should be contraindicated. So I think it's pretty clear कि हम PYQ जो पिछले वाले आए थे उसको भी डिस्कस कर ले रहे हैं, एंड आने वाले क्वेश्चंस भी पोटेंशियल MCQ आर आल्सो बीइंग डिस्कस्ड एज वी आर प्रोसीडिंग. एल्प्रोस्टाडिल, इट इज वन ऑफ द PGE1 एनालॉग. एल्प्रोस्टाडिल एक ऐसा प्रोस्टाग्लैंडिन जो दिल पे काम कर रहा है. तो आई टोल्ड यू टू इंपॉर्टेंट थिंग जो दिल से जुड़े हुए. एक तो इरेक्टाइल डिसफंक्शन दिल से जुड़ा हुआ है, आई मीन अगर आप समझ सकते हैं तो, और दूसरा कौन सा दिल से जुड़ा हुआ मामला है जिसको हम बोलते हैं देयर इज नोन एज इन अ ट्रांसपोजिशन ऑफ ग्रेट आर्टरी to maintain the patency of ductus arteriosus. So दो दिल के जुड़े मामले हैं, right? Erectile dysfunction and in a transposition of great artery, that's a cardiac malformation that we see. Next one, let's see. A patient with history of psychiatric condition on some medication was brought to the emergency with sudden hypertensive episode after consuming wine. So psychiatric condition में wine के बाद अगर problem आ रहा है, so which drug will be causing this possible outcome? I mean, the outcome is hypertensive emergency like scenario. Okay, so usually remember guys, psychiatric condition में अगर patient मान लीजिए एक patient है depression का है, if there is a patient with depression, or if there is a patient on Parkinson disease, he could be on MAO inhibitor like मेरा बेटा शेरा जैसा MAO B inhibitor, सेलेजिलिन, रासाजिलिन, याद है कि नहीं? सेलेजिलिन, रासाजिलिन, है ना, सेरेजिलिन, रासाजिलिन, दे आर द MAO-B inhibitor, है ना, डिप्रेशन में मोक्लिवेमाइड. So which of the following drug can cause the problem? Now phenelzine is a MAO inhibitor. Do remember some students are telling sir MAO inhibitor था, कुछ बोले सर नहीं सर फेनेजिलिन था पक्का, गारंटीड है सर, लिख के लो फेनेजिलिन था. तो यूजुअली समझिए जब 3 ऑप्शन रहता है ना ड्रग का नाम, तो चौथा ऑप्शन भी ड्रग ही होता है. कभी एग्जामिनर ऐसा डिस्क्रिपेंसी नहीं करेगा दैट देयर विल बी 3 ड्रग्स एंड 1 क्लास, है ना. दैट इज यूजुअली नॉट आइडियल सिनेरियो. तो whenever they give the class they will always give all the classes. तो चारों का क्लास रहता है, अल्फा ब्लॉकर या TCA या SSRI. अगर 3 का ड्रग था और एक आप बोल रहे हैं MAO इनहिबिटर, सो दैट इज समथिंग दैट आई कैन नॉट डाइजेस्ट. सो अगर फेनेल्जिन है तो फेनेल्जिन बच्चे बोल रहे हैं, तो आई एम टोटली एग्रीइंग दैट देयर वर चांसेस दैट पॉसिबली फेनेल्जिन वाज देयर. फेनेल्जिन इज अ MAO इनहिबिटर, है ना, एंड MAO इनहिबिटर कैन डेफिनेटली कॉज. MAO इनहिबिटर वाला पेशेंट अगर वाइन कंज्यूम करता है या कोई भी ऐसा फूड कंज्यूम करता है जिसमें टायरामीन होता है, सो दैट विल बी लीडिंग टू सर्टेन प्रॉब्लम. वी कॉल देम एज द चीज रिएक्शन. ठीक है. So what is the treatment? So for the treatment we will be using phentolamine. Phentolamine is one of the non-selective alpha blocker. Phentolamine is a non-selective alpha blocker. Clear? So again this is a recall. Quickly let's go through all these questions. Which of the following adverse effect is not seen even after a year of lithium therapy? So lithium side effect, isn't that we have already discussed lithium side effect. L stand for your leukocytosis. Lith is a simple mnemonic that I told you, leukocytosis. I stand for your insipidus. So which insipidus? So diabetes insipidus. Then we have tremor. Tremor happens to be the most common side effect. Tremor is the most common side effect. It is also a teratogenic. So pregnancy may we should try to avoid because it is associated with Epstein. Isn't that it has been asked in 2021 FMGE, which of the following drug will be causing Epstein anomaly? है ना. So in upcoming examination they can ask you Epstein anomaly patient will have which type of chest X-ray. तो box shape heart, tin से बनता है box shape heart, है ना, Epstein box shape heart, and hypothyroidism. So these are the side effects that we have discussed a couple of times already. Lith is a very very simple mnemonic for you to remember. So will it cause hypothyroidism? Yes. Diabetes insipidus? Yes. Will it cause tremor? Yes. Why will it cause tardive dyskinesia? Look at the tardive dyskinesia. Tardive dyskinesia, it is an extrapyramidal symptom. Tardive dyskinesia, it's one of the extrapyramidal symptom. ठीक है, that is mainly associated with the typical antipsychotics. With the typical antipsychotics, antipsychotics will be causing associated with typical antipsychotics mainly. All right. Next, which of the following non-depolarizing muscle relaxation will be causing Hoffman? I think ये क्वेश्चन तो पढ़ने का और इसमें टाइम स्पेंड करने का जरूरत ही नहीं था. Hoffman degradation due to structure rearrangement, some drug will be inactivated. So you can consider this as an anesthesia, consider this as a pharma, hardly matters क्योंकि दोनों लोग पढ़ाते हैं. ठीक है. Hoffman degradation दो जगह होता है, cis atracurium, atracurium, है ना, cis atracurium, atracurium. That is why they are considered safer in the renal failure patients. So next time they can give you this case based scenario, patient with the renal failure history and also hepatic failure history. Which of the following non-depolarizing muscle will be preferred? So safer in renal failure or hepatic failure will be cis atracurium because it's undergoing Hoffman degradation, है ना. So they are getting inactivated not by enzymatic metabolism but through the structural rearrangements. A young person is planning a trip to Ladakh. What is Ladakh? A place full of mountain. So mainly examiner is mainly asking mountain sickness. अब इसमें इससे ज्यादा आसान क्या होगा? Instead of telling a patient is going to mountain, they use a place, है ना, that mountain sickness. So mountain sickness के लिए what is the drug that will be preferred? Acetazolamide is a carbonic anhydrase inhibitor. This carbonic anhydrase inhibitor, it can also lead to your CSF acidosis. Boys and girls, any CSF acidosis, it will be doing what? It will cause any CSF acidosis whenever it is going to happen, it will be causing hyperventilation. Any CSF acidosis will be causing hyperventilation, and because of that there will be CO2 washout and oxygen का intake होगा. So in mountain sickness again, this is something that you can utilize. Mountain sickness में you can utilize carbonic anhydrase inhibitor. We are having acetazolamide, dorzolamide, and there are so many other drugs in this one, diclofenamide. Okay, so acetazolamide के multiple uses है ना. Acetazolamide इसके uses जो होते हैं मैं आपको बता चुका हूँ पहले. MECA is the mnemonic. So since this time they ask mountain sickness, they can ask you next time other. Mountain sickness is one of the area where it is the drug of choice. In epilepsy, like in a catamenial epilepsy we can use. In a glaucoma we can use. in angle closure glaucoma, and also for the alkalinization of the urine. This alkalinization of urine, boys and girls, it is required mainly in the acidic drug poisoning, है ना. तो MEGA is a simple mnemonic. So expected MCQ will be other use of acetazolamide. Sumatriptan is a drug for migraine. Is hyoscine scopolamine mainly for motion sickness. Promethazine is something that can also be used for the motion sickness. Okay. Next one. Thyroid hormone. Now you can consider this as a pharma, you can consider this as a physiology. We both used to discuss this. Thyroid hormone, thyroid. So they will be acting mainly by nuclear receptor. So we used to say what? That nuclear, nucleotide. So nuclear receptor se karne wale, we will be having thyroid, retinoic acid receptor, aryl hydrocarbon receptor, PPAR, peroxisome proliferator activated receptor, alpha and gamma. So all of them, they are going to act via your nuclear receptor. Nuclear receptor. Now nuclear receptor सब family दो तरह के होते हैं. कुछ साइटोप्लाज्म में होते हैं, कुछ न्यूक्लियस में होते हैं. Now these are mainly present in the nucleus. Nuclear receptor present in the nucleus. साइटोप्लाज्म में कौन से होंगे? Which all will be present in the cytoplasm. So remember mainly the steroids, है ना? Mainly the steroids like glucocorticoid, mineralocorticoid, sex steroid like your androgen, progesterone. Now there are some controversy to this as well, because in Goodman-Gilman at places they have mentioned that they are active and nuclear. Do remember they are all nuclear only. Nuclear के सब family हैं. Nuclear receptor पूरा है family है. उसके अंदर दो family है. Nuclear receptor present in the nucleus, nuclear receptor present in the cytoplasm, and a vitamin D as well. Its site is mainly present in the cytoplasm. Right, so these are the thyroid hormone receptor that we are having. They are mainly acting as a nuclear, not ligand gated or G protein or tyrosine kinase. Tyrosine kinase is the enzymatic receptor that we know already. Okay, ligand gated will be all the ion channels, like calcium chloride mediated, like GABA A, GABA C, nicotinic receptor, NMDA receptor, 5-HT3 receptor. They will be acting via your ligand gated. Let's see the next question after this one. The next question that we have is, which of the following agent is preferred in a patient with facial palsy? So facial palsy again nerve paralysis hai. So you will be giving steroids. This is the drug of choice. Agar wo hota ki if there is a patient with a history of some viral infection, then we would give steroid and acyclovir as well as acyclovir. है ना, जिसको Ramsay Hunt syndrome बोलते हैं. But here अगर facial palsy सिर्फ दे रहा है या some nerve inflammation is ongoing, we'll be using anti-inflammatory agent steroid like prednisolone. Okay. Next, which of the following agent is not used in the bacterial vaginosis? Not used in bacterial vaginosis. Usually the preferred agent is triindazole, metronidazole. Bacterial vaginosis mein you will be using metronidazole, triindazole. Clindamycin is something that can also be used, but what is not used will be your erythromycin. Erythromycin, it's one of the macrolide. Erythromycin is one of the macrolide, like clarithromycin and all. Clarithromycin, erythromycin, azithromycin, they will not be having a use in bacterial vaginosis, and metronidazole being the preferred agent. Next one, which of the following is not acceptable? Again, there were a lot of controversy around this one as well. Not acceptable as an emergency contraceptive with respect to the doses, and sometime with respect to this 0.05 or 0.75. Now what I came up from some of the students, sir, दो क्वेश्चन आए थे. एक में लेवोनोर्जेस्ट्रल के बारे में 0.75 डोज था और एक में 0.05 था, लेकिन ये जो इमरजेंसी कॉन्ट्रासेप्शन वाला था इसमें दे डायरेक्टली गिव 0.075. So sir, this question was as it is mentioned here. So I hope you guys are getting this point, that examiner when asked this one, you will be going ahead and reading the question very, very carefully. Not acceptable. Combined oral contraceptive pill, 2 tablets after 12 hours, 2 tablets immediately and 2 12 after 12 hours within 2 days. Ulipristal 30 mg single dose within 5 days. Centroman, right, 50 mg 2 tablets 12 hours apart within 24 hours. So ये वाला जो term था ना, this was a little confusing for all the students. बोल रहे थे बच्चे सर काफी बड़ा बड़ा ऑप्शन लग रहा था, but I think this was something that you should know, that levonorgestrel का either we use 0.75 or we use 1.5. दोनों में से कोई एक यूज करते हैं. नॉट, एंड दिस विल बी यूजिंग, अगर ये यूज कर रहे हैं दिस विल बी यूजिंग एज सिंगल डोज विद इन 72 आवर्स. ठीक है. एंड 0.75 इट विल बी यूज 2 डोजेस 24 आवर्स अपार्ट. 2 doses 24 hours apart है ना, 0.75 अगर देते हैं तो 2 doses 24 hour apart. So this will be the correct answer here. Levonorgestrel 0.005 is not an acceptable as an emergency contraception. Okay. Next one, let's see very quickly. Emergency contraception का again a quick summary that we are having within 72 hours क्या देंगे और within 5 days. Within 5 days or best that we are having is IUCD, that's the most preferred one. Some students were saying sir IUCD भी option था. See, even if IUCD was there in option, that is an acceptable. That's an acceptable emergency contraception within 5 days. Uripistol 30 milligram as soon as possible or within 5 days. That is there in the option. Combined oral contraceptive pills immediately 2 tablets. One is after 12 hours, one is immediately. Levonorgestrel 1.5 milligram single or 0.75 2 tablet, not 0.075. ठीक है. Ormeloxifene Centropan also can be used for emergency contraception. Do remember, it's for emergency contraception, not for abnormal uterine bleeding or not for regulating the menstruation. उसके लिए नहीं यूज कर रहा है. emergency contraception का क्या डोज है उस पर भी ध्यान रखना है. many people were telling सर वीकली देते हैं all, है ना. तो आइडिया देखिए कि कहाँ पे पूछ रहा है, कहाँ पे देना है. is it for regulation of the menstruation or is it for emergency contraception? Okay, now let's see the next one. A patient given penicillin. Now penicillin mediated hypersensitivity is IG mediated type 1. So ये तो मैं बार बार बोल चुका हूँ है ना, जब भी हम ऑटोनॉमिक नर्वस सिस्टम एड्रेलिन पढ़ते हैं है ना. So इसमें the drug of choice it is going to be adrenaline है ना. adrenaline 1:1000 intramuscular route. So you can say that this is a pharma question, micro question, patho question, doesn't matter. अगर आपने इन तीनों में से कोई भी क्लास किया है तो तीनों लोग पढ़ाए. अगर मैं फार्मा की बात करूं तो I have discussed with all of you guys where I was discussed the adrenaline कहाँ देंगे तो penicillin mediated hypersensitivity reaction. एग्जैक्ट केस मैंने लिख के दिया हुआ है, देखिएगा आप लोग. ठीक है. तो what will be the antibody mediated, तो IG mediated type 1 hypersensitivity reaction. Okay. हाइपरसेंसिटिविटी पे 3 क्वेश्चन थे, 2 फार्मा से इंटीग्रेटेड थे. अ पेशेंट विद लेप्रोसी. सो लेप्रोसी में 2 तरह के लेप्रा रिएक्शन हो सकते हैं. लेप्रा रिएक्शन कैन बी ऑफ 2 टाइप. वन इज नोन एज टाइप 1 लेप्रा रिएक्शन एंड अदर वन इज नोन एज टाइप 2 लेप्रा रिएक्शन. टाइप 1 लेप्रा रिएक्शन इज type 4 hypersensitivity because I told you that the total score or rule of 5 should be followed. Rule of 5 should be followed. Type 1 will be 4th type of hypersensitivity और type 2 will be टाइप 3 हाइपरसेंसिटिविटी. तो रूल ऑफ 5 हो गया बिकॉज अल्टीमेटली आपको दोनों को मिला के 5 बनाना है. तो 2 और 3 5 हो गए और 1 और 4 यहाँ 5 हो गए. तो इफ यू ऑलरेडी नो द रूल ऑफ 5 देन यू कैन टेल मी टाइप 2 लेप्रा रिएक्शन में कौन सा होगा. 2 और 3 5 बनाना है तो टाइप 3 हाइपरसेंसिटिविटी रिएक्शन. राइट. So lepra reaction is type 2 will be type 3rd hypersensitivity reaction. So 2 questions of hypersensitivity reaction. In fact, there were 3 questions of hypersensitivity reaction total. 2 can be integrated easily with the pharma, and we usually very commonly discuss this. A patient with pheochromocytoma underwent surgery. Which of the following agent is given prior to the surgery to control the intraoperative hypertension? Now pheochromocytoma का नाम जहाँ कहीं भी आए, what is one drug that you are going to prefer? The drug of choice for pheochromocytoma, it is none other than the drug of choice for pheochromocytoma. It is none other than your phenoxybenzamine. Look at the name, such a big name, phenoxybenzamine, used for pheochromocytoma. Such a big name, phenoxybenzamine used for pheochromocytoma. Right now, phenoxybenzamine is one of the non-selective alpha blocker. That is alpha 1 alpha 2 both blocker, and it is always added. We are always going to add phenoxybenzamine with, है ना, हम इसके साथ बीटा ब्लॉकर ऐड करते हैं और इसी ऑर्डर में देते हैं. पहले अल्फा ब्लॉकर फिर बीटा ब्लॉकर, इसी ऑर्डर में देते भी हैं. ठीक है. नाउ अल्फा एड्रेनर्जिक ब्लॉकर इज द आंसर हियर. वेरी वेरी इजी है ना, वेरी वेरी इजी. नाउ दिस टाइम अगेन सी दे आर नॉट गिविंग नेम ऑफ द ड्रग, दे आर गिविंग क्लास ऑफ द ड्रग, है ना. सो फेनॉक्सीबेंजामिन सबने रट लिया. आप किस क्लास का ये बताओ. इज इट बीटा ब्लॉकर, अल्फा ब्लॉकर? कैन वी यूज बीटा ब्लॉकर? यस, बट डू रिमेंबर अगर पूछ रहा है कौन सा प्रिफरेबल है हमारे लिए, तो पहले हमेशा हम अल्फा एड्रेनर्जिक ब्लॉकर ही देते हैं. ठीक है. 5 alpha reductase inhibitor will be utilized for BPH. Phosphodiesterase inhibitor, we are having many type of phosphodiesterase. Phosphodiesterase 3 in heart failure, it has antiplatelet activity. Phosphodiesterase 4 can also be used in COPD as an anti-inflammatory. Phosphodiesterase 5 in a patient with a erectile dysfunction we can also use, like sildenafil, tadalafil. Okay, so we quickly revise that as well. Next, a patient consumed an anti-emetic agent metoclopramide. Which of the following statement is incorrect about this drug? Which of the following is incorrect? Now metoclopramide is what? It's a D2 blocker. It's a prokinetic, and what we know already that this prokinetic, it's similar to your domperidone, but domperidone does not cross the blood-brain barrier. This actually crosses the blood-brain barrier. because it crosses blood-brain barrier, it can cause D2 blockade in the CNS as well, and it will be associated with extrapyramidal symptom. That is a not a very commonly used prokinetic agent. So can cause hyperprolactinemia. See, dopamine always have inhibitory effect on the prolactin. Dopamine हमेशा prolactin को रोक के रखता है, भाई सब रुक जाओ, ज्यादा मत जाओ, है ना, ज्यादा सिगरेट नहीं हो. Now if dopamine is inhibited, prolactin level will automatically be high. So hyperprolactinemia. So can it cause hyperprolactinemia? Yes. Can it cause extrapyramidal symptom? I just mentioned yes. It will be causing extrapyramidal symptom like dystonia, akathisia. It crosses blood-brain barrier. That is how it is going to cause CNS symptom. It is safer than domperidone? No. It is not safer than domperidone. Domperidone is more safer because domperidone does not produce extrapyramidal symptom like dystonia, akathisia, oculogyric crisis. Okay, next one, oculogyric crisis. A 55-year-old diagnosed with cervical cancer. What is the drug of choice? Cervical cancer drug of choice cisplatin. Have I already told you that cisplatin, it is one of the platinum compound. It is considered the drug of choice in many conditions. It is considered the drug of choice in a patient with a head and neck cancer. It is considered the drug of choice in a patient with the upper GI cancer. Upper GI cancer like esophageal cancer, it is the drug of choice. It is also considered the drug of choice in a patient with a gastric cancer. It's the drug of choice. It's also the drug of choice in a patient with the cholangiocarcinoma. We have discussed this. Cholangiocarcinoma, cisplatin. It's also the drug of choice in a patient with the genitourinary carcinoma. तो genitourinary carcinoma में क्या क्या आ जाएगा? What all things will come in genitourinary carcinoma? So there will be bladder cancer. There will also be cervical cancer, ovarian cancer, testicular cancer. All this will come. Testicular cancer, all this will come, and all these are going to be the indication of your cisplatin. In fact, cisplatin can also be used in a patient with a lower GI carcinoma, but not the drug of choice. Lower GI cancer में drug of choice होता है. Drug of choice in lower GI cancer that can be potential MCQ is going to be 5-fluorouracil. 5-fluorouracil. But can we use cisplatin also? Yes, we can use cisplatin as well. So it's a very, very simple question. We are not going to use selective estrogen receptor modulator like tamoxifen. Paclitaxel is one of the taxanes MPhase inhibitor that is having multiple uses, like for example ovarian cancer, breast cancer. Adriamycin again is a drug that is not the drug of choice. Drug of choice पूछता है तो cisplatin becomes the drug of choice. ठीक है? Next, 60-year-old female presented with cervical carcinoma. Now I got two versions of this one. Hours ago only I got this version that there is a 60-year-old female and she was diagnosed with cervical cancer. She was treated with cisplatin. तो cisplatin पे दो क्वेश्चन हो गए, हाइपर सेंसिटिव पे दो क्वेश्चन हो गए. विच ऑफ द फॉलोइंग द मोस्ट इंपॉर्टेंट टॉक्सिटी? नाउ कुछ बच्चे बोल रहे थे कि सर मोस्ट कॉमन साइड इफेक्ट आएगा. सी मोस्ट कॉमन तो यूजुअली जीआई रिलेटेड साइड इफेक्ट आता है. मोस्ट पीपल जितने लोग को देते हैं ज्यादातर लोग को नोजिया वोमिटिंग होता ही होता है. तो जीआई साइड इफेक्ट इज नोजिया वोमिटिंग डायरिया. तो ज्यादातर लोगों में नोजिया वोमिटिंग होगा. तो मोस्ट पीपल अगर पूछते हैं तो नोजिया वोमिटिंग. बट स्टूडेंट्स क्लियरली सेड सर मोस्ट कॉमन नहीं था, मोस्ट इंपॉर्टेंट टॉक्सिसिटी था. सो मोस्ट इंपॉर्टेंट टॉक्सिसिटी रिमेंबर थोड़ा सा चेंज किया, थोड़ा सा लैंग्वेज, मोस्ट कॉमन से मोस्ट इंपॉर्टेंट टॉक्सिसिटी बोल दिया तो तुरंत से वक्त, जज्बात, हालात सारे बदल गए, है ना, आंसर बदल गया. जीआई टॉक्सिसिटी से अब इसका आंसर क्या होता है? नेफ्रोटॉक्सिसिटी. एंड फॉर द प्रिवेंशन ऑफ द नेफ्रोटॉक्सिसिटी वी गिव फ्लूइड लोड, फ्लूइड लोडिंग करते हैं, क्लोराइड डायूरेसिस करते हैं, एंड वी ऑल्सो यूज द नेफ्रोप्रोटेक्टिव एजेंट एमीफॉस्टीन. एमीफॉस्टीन इज द नेफ्रोप्रोटेक्टिव एजेंट, है ना. So do remember, it is not something that will be causing mainly pulmonary fibrosis. It is a side effect that is associated with bleomycin, busulfan, cyclophosphamide, methotrexate. They will be causing pulmonary fibrosis. तो देखा आपने, है ना, थोड़ा सा लापरवाही का नतीजा, है ना. तो ध्यान रखना है, क्वेश्चन को बहुत ध्यान से पढ़ना है. एंड सिली मिस्टेक्स आर द मोस्ट कॉमन कॉज ऑफ मिस्टेक दैट वी ऑलवेज यूज्ड टू से इन द क्लास एज वेल. आई ऑलवेज यूज्ड टू से इन द क्लास. ठीक है. विच ऑफ द फॉलोइंग कॉजेस थायमिडीन लेस डेथ ऑफ द कैंसर सेल? थायमिडीन लेस डेथ, दैट मींस थायमिडीन इज वन ऑफ द पिरिमिडीन. सो एग्जामिनर इज आस्किंग कि इनमें से कौन सा है जो पिरिमिडीन के फॉर्मेशन को इनहिबिट करेगा. तो पिरिमिडीन के फॉर्मेशन को वही इनहिबिट करेगा विच इज हैविंग पिरिमिडीन लाइक एक्टिविटी. सो ओनली वन दैट इज हैविंग पिरिमिडीन एनालॉग इज 5-fluorouracil. as simple as that. Thymidine is one of the pyrimidine, है ना. 6-mercaptopurine is a purine analog. Methotrexate is one of the dihydrofolate reductase analog, not inhibitor, analog. साइक्लोफॉस्फेमाइड इट्स वन ऑफ द एल्काइलेटिंग एजेंट, ठीक है। तो थाइमिडीन लेस डेथ, जब आप एंटी कैंसर चैप्टर खोलोगे रेगुलर वाले लेक्चर में, मेन लेक्चर में चेक कर सकते हैं, एंटी कैंसर ड्रग जब आप खोलेंगे तो एग्जैक्टली सेम लाइन, ये जानते हैं कहां से उठाया गया, दिस एग्जैक्ट सेम लाइन हैज बीन टेकन फ्रॉम गुडमैन गिलमैन, है ना, उसको बोल्ड करके अंडरलाइन करके, है ना, सेमी कॉलम में दिया हुआ है, दिस ड्रग विल बी कॉजिंग थाइमिडीन लेस डेथ, है ना, थाइमिडीन लेस डेथ। ओके, pediatric patient brought with fever, status epilepticus, he has history of similar episode before, and which of the following step will be used in the management of this patient? Now अगर पेशेंट को फीवर है और स्टेटस एपिलेप्टिकस है, यू डोंट ओनली ट्रीट द फीवर, नो, है ना, एंड यू आर नॉट वरीड मेनली अबाउट बीपी, एंड यू आर नॉट ओनली गोइंग टू रिलाई ऑन क्लोबाजाम. Clobazam is type of benzodiazepine. Their activity is like a benzodiazepine only. They are one of the GABA A analog, है ना, so their activity is like benzodiazepine. Clobazam is something that is used in a patient with the Lennox-Gastaut syndrome along with other drugs. Along with other drugs we can use clobazam, है ना, other anti-epileptic drugs we can use clobazam, but अगर यहाँ पे आ रहे status epilepticus में तो we are going to prefer midazolam. Now remember, अगर आपके पास ऑप्शन दोनों हो कि मिडाजोलाम और लोराजिपाम, तो अगर IV एक्सेस है, आस्क और चेक IV एक्सेस इज देयर, देन गो फॉर IV लोराजिपाम, गो फॉर IV लोराजिपाम, बट यहाँ पे कुछ मेंशन नहीं किया है, बस बोल रहा है कि कैन वी यूज मिडाजोलाम, यस. अगर IV एक्सेस नहीं है, then we are going to prefer midaz, so we can give midaz as well, midazolam as well. Do remember, है ना, यहाँ से पेशेंट स्टेटस एपिलेप्टिकस के साथ आ रहा है, so this is one of the American Epilepsy Society का समराइज्ड गाइडलाइन है, this is from American Epilepsy Society का समराइज्ड गाइडलाइन है. Read the discussion here very carefully. If no IV access available, then can we use midazolam IM? Yes, we can use midazolam IM, or we are also having buccal. डोज इंपॉर्टेंट नहीं है, बट मिडाज आपको दे सकते हैं, IM दे सकते हैं. अगर IV एक्सेस अवेलेबल है, देन डेफिनेटली वी आर गोइंग टू प्रेफर व्हाट, IV लोराजिपाम, ठीक है. बहुत सिंपल सा डिस्क्रिप्शन है, कुछ ज्यादा कॉम्प्लिकेशन है नहीं, है ना. कैन वी यूज मिडाज? यस, बिकॉज वी आर हैविंग नो IM प्रिपरेशन एज वेल. IV लोराजिपाम डेफिनेटली इज अ ड्रग ऑफ चॉइस, ठीक है. अगर इससे रिस्पॉन्ड नहीं करता है, इफ इट इज नॉन रेस्पॉन्सिव टू दिस वन, देन वी आर गोइंग टू गिव phosphenitoin. Phosphenitoin is one of the prodrug of phenytoin, है ना, और we can give other anti-epileptic drug like levetiracetam, है ना, और valproate. उससे भी काम नहीं चलता है ना. मान लीजिए आपने मिडाज और लोराजिपाम दिया, डायजिपाम दिया, काम नहीं चला, तो आपने फॉस्फेनिटोइन दिया. फॉस्फेनिटोइन अगर नहीं था तो यू कैन गिव लेट्स से लेवेटिरासेटाम, वालप्रोएट, राइट. इससे भी काम नहीं चला, देन यू विल गिव बार्बिटुरेट. इफ स्टिल नॉट रेस्पॉन्सिव टू दिस वन, then you can actually sedate the patient, you can give general anesthesia, like you can give propofol, you can give ketamine, है ना. तो ये समराइज डेटा मैं आपको बता रहा हूँ, है ना. you are going to anesthetize the patient, ठीक है. तो ये हो गया आपका status epilepticus. Now you can say that this will be a very much similar to pediatrics, very much similar to what was discussed in medicine, similar to what was discussed in pharma. We have discussed this already, right? So midaz can we give? Yes, midaz is something that can also be utilized. Next, 5-year-old child brought to OPD by parents with complaints of squint and decreased vision for doing the refraction testing. अगर आपको याद होगा तो कुछ दिन पहले एलन के पेज पे भी और मेरे इंस्टा के पेज पे भी सेम क्वेश्चन, एग्जाम के जस्ट 3 दिन पहले ये क्वेश्चन पोस्ट हुआ था, है ना, कि फॉर टेस्टिंग द रिफ्रैक्शन इन अ पीडियाट्रिक पॉपुलेशन व्हाट विल यू यूज. सो पीडियाट्रिक्स में वी आर गोइंग टू यूज एट्रोपिन, और प्रॉपर डिस्क्रिप्शन भी मैंने दिया हुआ है कि इन पीडियाट्रिक पॉपुलेशन द सिलरी मसल टोन इज वेरी हाई. Ciliary muscle tone is very high. So go ahead and join LNX का जो इंस्टा है उस पे भी काफी MCQ हम पोस्ट करते रहते हैं ऑन रेगुलर बेसिस, सो दैट नोविंगली और अननोविंगली, अनइंटेंशनली अगर आप स्क्रॉल भी कर रहे हो तो कुछ लर्निंग हो जा रही है ना. सिलरी मसल टोन क्या होता है? हाई होता है. किसका? पीडियाट्रिक पॉपुलेशन में. तो विल बी यूजिंग पोटेंट, है ना, पोटेंट ऑइंटमेंट यूज करते हैं, ध्यान रखिएगा. ड्रॉप नहीं यूज करते हैं, ऑलवेज ऑइंटमेंट, बिकॉज ड्रॉप विल हैव मेनी ऑफ द सिस्टमिक साइड इफेक्ट लाइक एट्रोपिन, फीवर, ठीक है. बट एडल्ट में क्या प्रीफर करेंगे? इन एडल्ट वी विल बी प्रीफरिंग ट्रोपिकामाइड. इफ ट्रोपिकामाइड इज नॉट देयर इन ऑप्शन, देन वी कैन आल्सो गो अहेड विद द साइक्लोपेंटोलेट. दिस गोज इन द सेम ऑर्डर, ठीक है. ट्रोपिकामाइड इज द माइल्डर वन, एंड मोस्ट पोटेंट वन इज द एट्रोपिन, दैट इज लास्टिंग फॉर अराउंड 7 to 10 days, है ना. इन सब टेक्स्ट दे आल्सो से अप टू 14 days हाफ लाइफ इसका लॉस कर सकता है एट्रोपिन का. तो एडल्ट में यूजुअली वी अवॉइड दिस वन, है ना, बिकॉज देयर विल बी प्रोलॉन्ग ब्लड विजन. No, we should avoid that. Which is correct regarding step criteria of the drug? स्टेप क्राइटेरिया ऑफ अ ड्रग, है ना। आई रिमेंबर आई डिस्कस दिस ट्वाइस थ्राइस ओनली, फिर मुझे लगा कि ये ज्यादा हो रहा है, तो अगर आप पुराने लेक्चर्स देखोगे तो स्टेप क्राइटेरिया इट इज मेनली फॉर चूजिंग पी ड्रग्स, फॉर चूजिंग द पी ड्रग्स, फिजिशियंस ड्रग, है ना, फिजिशियन ड्रग। तो आजकल जितने भी मेडिकल कॉलेजेस में आप जाओ तो देयर आर फ्यू टॉपिक दैट आर डिस्कस्ड इन वेरी मच इन डिटेल। जैसे कि मैं आपको आज बता रहा हूँ, एक पी ड्रग है जिसको अच्छे से इस पे लैब होता है, प्रॉपर इसका डिस्कशन होता है ना। ड्रग प्रोमोशनल लिटरेचर, डीपीएल जिसको बोलते हैं, ड्रग प्रोमोशनल लिटरेचर, ये आपके सिलेबस का है, ड्रग प्रोमोशनल लिटरेचर, है ना। और जो एग्जामिनर है वो समहाउ दे बिलोंग टू दीज एरियाज, ड्रग प्रमोशनल लिटरेचर, बिकॉज आपके एग्जामिनर कहीं मार्च से तो नहीं आ रहे, इसी प्लेनेट के हैं, इसी किसी न किसी मेडिकल कॉलेज से होंगे, है ना। तो ट्राई टू अंडरस्टैंड, ये मेडिकल कॉलेज में बहुत स्ट्रिक्टली फॉलोड लैब टॉपिक्स हैं जो डिस्कस होते हैं, है ना। एसेंशियल मेडिसिन, एसेंशियल मेडिसिन का टॉपिक, है ना, ओआरएस वाला टॉपिक, है ना, रैबिट आई वाला टॉपिक, है ना, एंड सम हार्ट वाले जो अफेक्ट ऑन अफेक्ट ऑफ सर्टेन ड्रग्स ऑन द हार्ट, ये सारे बहुत ही डिटेल में डिस्कस किए जाते हैं कॉलेजेस में। तो इसलिए आपको ध्यान रखना पड़ेगा स्टेप मेनली, है ना, सेफ्टी, टॉलरेबिलिटी, है ना, एफिकेसी एंड प्राइस, प्राइस यानी कि कॉस्ट, है ना। तो ये स्टेप ऐसा कोई क्राइटेरिया नहीं है, ये एक कॉन्फ्रेंस ने, एक स्पीकर ने इसको समराइज करने के लिए, सिंप्लीफाई करने के लिए उन्होंने यूज किया था स्टेप क्राइटेरिया, और जब से ये यूज हो रहा है, ऐसा कोई हार्ड एंड फास्ट नहीं है ना। सेफ्टी, एफिकेसी, सुटेबिलिटी, कई लोग ऐसे भी बोल देते हैं, लेकिन स्टेप क्राइटेरिया अगर बोल रहा है तो मेनली दिस इज फॉर चूजिंग द कॉन्सेप्ट ऑफ द पी ड्रग, नॉट फॉर द क्लिनिकल ट्रायल और फॉर द वॉल्यूम डिस्ट्रीब्यूशन ऑफ द ड्रग मेटाबॉलिज्म। तो पी ड्रग को चुनने के लिए हमारे पास बहुत सारे तरीके हैं, and for the criteria that we are using is the step criteria is the safety, tolerability, whether the patient will be able to tolerate or not, whether the patient will be able to take it or not, suitability of the patient, like for example if you have to choose oral drug versus per rectal drug, so you'll be choosing oral because oral will be more suitable for the patient, it will be more easy for him, and efficacy, how effective is the drug, and cost should always be considered not in terms of per tablet but in terms of entire cost of the therapy. For example, let's say एक एंटीबायोटिक है मार्केट में 20 रुपए की आ रही है वंस डेली, लेट्स से मैं आपको एक नाम बता रहा हूँ, आपको अच्छे से पता चल जाएगा, एजिथ्रोमाइसिन आता है 500 मिलीग्राम वंस डेली, तो इसका आता है ₹20 पर टेबलेट। कोएमॉक्सिक्लैब 625 मिलीग्राम, इसको बीडी और टीडीएस डोज में देते हैं, और इसका भी आता है 20 पर टेबलेट। नाउ कैन यू से दैट दे बोथ आर हैविंग सिमिलर कॉस्ट? नो, because you have to consider the cost of the entire therapy. Amoxiclav अगर patient लेता है तो more or less he will have to spend around 200 or sometime more than 200 like 300. Azithromycin अगर लेता है तो around 110 रुपीस में काम हो जाएगा, because इसको once daily लेना है और इसको twice or thrice daily लेना है। बात समझना है? तो you'll be considering the entire cost of the therapy rather than discussing the per tablet. ठीक है, कॉस्ट पर यूनिट नहीं, पर टैबलेट नहीं, ठीक है। तो पी ड्रग के लिए फर्स्ट एंड फॉरमोस्ट पी ड्रग इज फिजिशियंस ड्रग ऑन द बेसिस ऑफ द एक्सपर्टीज ऑफ द फिजिशियन according to the disease that is prevalence in that area, in their area, they will be coming up with their P drug, है ना। Now this P drug can vary, physician's drug, P drug मतलब physician drug or preferred drug. It is never personalized drug. Remember, it is preferred drug or physician's drug. It is never personalized drug. Please remember that, है ना। तो पहले diagnosis बनाइए, then you make what are the therapeutic objective that you are going to do here, and inventory मतलब what are the classes of drugs that you can use here, and out of that you use the step, the criteria that they are telling, that you use the step, that is safety, tolerability, efficacy and price, and then out of them which tops the list, choose that as a P drug, है ना। So in some areas, let's say upper respiratory tract infection, let's say for me, I prefer giving azithromycin, but in some places I see in fact in just 200-300 kilometers from my place, I see the physicians are more preferring, let's say cefixime, or let's say some other cephalosporin or coamoxiclav, and they are telling for their patient in their area azithromycin is something that is not showing much effect. So it is totally dependent on the physicians on expertise, right? P drug. So step criteria is for choosing a concept of P drug. Okay, this was a pulmonary TB case in a pediatric population, and they asked that pediatric population में क्या कैसे treat करोगे? See, pediatric adult दोनों में treatment same रहेगा, क्या रहेगा? So 2 HRZE दैट इज आइसोनाइजेट रिफाम्पिसिन, प्यारजेनामाइड, एनिथम्बिटॉल। प्यारजेनामाइड को मैं, पायराजेनामाइड को मैं जानबूझ के प्यारजेनामाइड बोलता हूँ। अगर आपने कभी मेरा टीबीए क्लास लिया होगा तो मैंने बताया 5 रीजन क्यों मैं इसको प्यारजेनामाइड बोलता हूँ, ठीक है। प्लस 4HRE, ठीक है, 4HRE। Steroids is something that is not preferred until unless there is, let's say, CNS involvement or pericarditis involvement, right, or some other systemic condition like, let's say, ocular infection like uveitis, उसमें हम steroid use करेंगे। अदर देन दैट हम steroid यूज नहीं करेंगे। तो 2HRZD प्लस 4HRE यही प्रीफर करेंगे हम। वी आर गोइंग टू प्रीफर द सेम एंड अकॉर्डिंग टू द गाइडलाइंस ऑफ टीबी एलिमिनेशन प्रोग्राम दैट वी हैव, this is one table that we are having, HRZD that we are going to use. Do remember, streptomycin is a reserved drug. It is not given as a first line drug. It's a reserved drug. Category C drug में आते हैं, aminoglycoside category C drug में आते हैं, ठीक है। But HRZD, according to the guideline of 2022, this table has been taken from the guideline of 2022. Do remember that steroids के, as I said, CNS condition like TB meningitis, cardiac condition like pericarditis, अगर पेशेंट को साथ में एडिसन्स डिजीज है या मिलियरी ट्यूबरकुलोसिस विद एल्वियोलो कैपिलरी ब्लॉक और टीबी यूवेटिस, ये सारे इंडिकेशन है स्टेरॉइड की अगर टीबी को ट्रीट करना है। और एंटी ट्यूबरकुलर के साथ इफ यू वांट टू गिव स्टेरॉइड, दीज आर द इंडिकेशंस। डू रिमेंबर दैट, ओके। 2HRZD एंड 4HRE। सो दिस इज अगेन स्क्रीनशॉट टेकन फ्रॉम 2022 का गाइडलाइन ऑफ टीबी पेशेंट, नेशनल टीबी एलिमिनेशन प्रोग्राम वाले पीडीएफ से लिया हुआ है, ठीक है। अ पेशेंट हैज अनकंट्रोल्ड पोस्टमार्टम ब्लीडिंग, patient had PT and APTT was normal. There is history of similar kind of profuse bleeding in the past. Okay, so bleeding ज़्यादा हो रहा है, PT APTT normal है, and history in the past. That means कुछ तो deficiency है. So examiner is asking which vitamin deficiency. See, factor 8 deficiency will be causing some condition like, let's say, hemophilia A. This will be causing a condition called your hemophilia A. This will be causing a condition called your hemophilia B, ठीक है। And von Willebrand will be causing von Willebrand disease. But यहाँ पे PT APTT normal है, पूछ रहा है which of the following deficiency can cause. So vitamin K deficiency, because vitamin K deficiency होगा तो vitamin K dependent factors will not be formed. If they are not going to be formed, definitely there will be bleeding. So our drug warfarin, isn't that we always discuss warfarin? Warfarin is a competitive inhibitor of vitamin K dependent factors. Vitamin K dependent factors. So some of them are clotting factor like 2, 7, 9 and 10, है ना? Clotting factor like 2, 7, 9 and 10. Okay, 2, 7, 9 and 10. We are having one more question. This is integrated with medicine, I would say. This is purely integrated with medicine. Addition is में starting किससे करेंगे? So we will be starting with the 100 milligram. We are going to start with the 100 milligram in the addition disease steroid. So this is again for sickle cell crisis integrated with medicine. Remember, we will be preferring always heparin. Now some students were telling, sir, IV था, कुछ बोले थे subcutaneous था, कुछ बोले थे कोई नहीं था। तो sickle cell crisis में the preferred anticoagulant we prefer is always heparin. Remember, we are not going to rely on just by giving warfarin, because warfarin complete onset of action will be taking around 4-5 days and तब तक काफी सारे organ damage हो चुके होंगे, तो we will not be going ahead with that. And if you have to choose between rivaroxaban oral versus heparin injectable, we will definitely preferring heparin, है ना। Aspirin is for antiplatelet. Again, antiplatelet is something that should be avoided here because bleeding risk is already high है. So we will not be choosing aspirin is actually antiplatelet. और यहाँ पे हमें thrombus को अगर thrombus formation को inhibit करना है तो we will be giving anticoagulant like heparin. Okay. So this was one of the very important question, and I think this was the last question that we had, and you can consider this an integrated question of the medicine. So quickly in the next let's say 50-60 सेकेंड, 1 मिनट में जल्दी से सारे क्वेश्चन को देख लेते हैं। तो आई थिंक आई हैड अराउंड 35 क्वेश्चन, दैट इज शॉकिंग। 35 क्वेश्चन में लास्ट के 3 इंटीग्रेटेड विद मेडिसिन है, तो फिर भी कम कर दो अगर, तो 30 क्वेश्चन ऑन एवरेज मेडिसिन से फार्मा से आए हुए हैं। उसमें से भी 2 क्वेश्चन और हटा दो जो कुछ गायनी वाले हैं और एक एनेस्थीसिया वाले, तो 28 क्वेश्चन, 28 क्वेश्चन फार्मा से, जो आप फार्मा के नोट से कर सकते हैं। जो हॉफमैन एलिमिनेशन था वो भी फार्मा के नोट से कर सकते हैं। जो हाइपर सेंसिटिविटी रिएक्शन वाला था पेनिसिलिन इंड्यूस्ड, और योर लेप्रा ना, टाइप 2 लेप्रा रिएक्शन, वो भी कर सकते हैं, है ना। तो एक बार जल्दी 60 सेकंड में लेके चलते हैं आपको क्विकली, है ना, क्विकली एक बार जल्दी से रिवाइज कर लेते हैं फॉर ऑल ऑफ यू गाइस। सिकल सेल क्राइसिस में वी विल बी यूजिंग हेपारिन। एडिशन डिजीज में स्टार्टिंग डोज ऑफ स्टेरॉइड शुड बी 100 मिलीग्राम, and vitamin K deficiency will be having no prolonged history of bleeding. History of bleeding is always going to be there if there's a vitamin K deficiency. Then pediatric population, adult population, 2 HRE and 4 HRE. This is again according to the guideline as well. As I've told you, step is for choosing a P drug. P drug is physicians or the preferred drug. 5-year-old child brought to the OPD with squint. So pediatric population, if you want to do refraction, if you want to do mydriasis cycloplegia, you'll be preferring atropine ointment. Adult में tropicamide. Then we are having मिडाजोलाम फॉर अ पेशेंट विद स्टेटस एपिलेप्टिकस. अगर आईवी रूट है तो आईवी लोराजिपाम प्रीफर करेंगे. आईवी एक्सेस नहीं है तो मिडाजोलाम को हम आईएम दे सकते हैं, मिडाजोलाम को हम बक्कल भी दे सकते हैं. ओके, विच ऑफ द फॉलोइंग causing thymidine less death? तो pyrimidine analog like 5-fluorouracil. Cisplatin therapy will be having most important toxicity like nephrotoxicity. To prevent that, amifostine will be preferred. ME में आई यहाँ छूट गया, amifostine. ठीक है. 55-year-old patient diagnosed with cervical cancer, drug of choice cisplatin. Cisplatin will be the drug of choice in many cancer, as I mentioned there. And metoclopramide is unsafe. They will be causing extrapyramidal symptom. They are unsafe than domperidone. Intraoperative hypertension, pheochromocytoma, alpha blocker like phenoxybenzamine will be preferred. Lepra, type 2 lepra reaction, type 3 hypersensitivity. And penicillin-induced hypersensitivity will be type 1 hypersensitivity. Emergency contraception के लिए levonorgestrel 0.075 नहीं होता है, 0.75 या 1.5 होता है. Which of the following not in bacterial vaginosis? Erythromycin is macrolide, not effective in bacterial vaginosis. Facial palsy में preferred will be steroid. Nuclear receptor, thyroid hormone will be acting on nuclear receptor. General pharma का बहुत favorite topic है ना. Then mountain sickness के लिए acetazolamide is something that will be preferred. Other use of acetazolamide we have already covered here. Cisatracurium, Hoffman elimination we have already discussed here. And adverse effect not seen in the lithium therapy. Lithium will not be causing tardive dyskinesia. Tardive dyskinesia is an extrapyramidal symptom associated with the typical antipsychotics that we have discussed already. Phenelzine is a MAO inhibitor. MAO inhibitor can increase the risk of cheese reaction or anything that is having a tyramine, tyramine rich food, wine, banana, beef, and all those things, or any food product that is having milk in it. Okay, carboprost will be preferred for the uterine contraction. In this scenario, it's a case-based scenario. You can say that this is integrated with gynae as well. Okay, well, ganciclovir will be preferred. Ganciclovir CMV retinitis, the drug of choice. 5-alpha-hydroxylase inhibitor for benign prostatic hypertrophy. Fluoxetine will be causing SSRI wale side effect. So again, serotonin syndrome, sexual dysfunction, restlessness, insomnia. That is what it is seen here. Now some students are saying, sir, ऐसे नहीं आया था, वो सिर्फ पूछा था मेजर डिप्रेसिव डिसऑर्डर है, उसमें कौन सा एंटी डिप्रेसेंट है. तो इन पूरे लिस्ट में इकलौता एंटी डिप्रेसेंट है, दैट इज फ्लूक्सेटिन. फ्लूक्सेटिन इज ओनली एंटी डिप्रेसेंट. ऑल अदर्स आर यूज्ड इन सम अदर कंडीशन लाइक हेलोपेरिडोल इज एंटीसाइकोटिक, बिस्पिरोन इज एंग्जाइटिक, लिथियम इज यूज्ड फॉर मैनिया. ठीक है, तो दोनों ही कंडीशन में आंसर सेम रहता है, फ्लूक्सेटिन. Betaquilin, mechanism of action they asked. So ATP B or A, ATP synthase inhibitor. And do remember about other, that is delamanid, pitamid, manid and manid, that is mycolic acid synthase inhibitor. For prevention of mother to child transmission, nevirapine for 6 weeks will be given 2 mg per kg. Immediately will be starting, within 72 hours we should start. Then different antidotes. एंटीडोट पे 3 क्वेश्चन आए थे. एक तो आयरन के लिए आयरन ओवरडोज हो गया ड्यू टू रिकरेंट ब्लड ट्रांसफ्यूजन. So deferriprone, we have discussed this very frequently. Flumazenil for benzodiazepine overdose, and fomepizole we are going to use for methanol or ethylene glycol poisoning, right? So this will be everything which we wanted to discuss in pharmacology recall. I hope it was beneficial for all of you guys. Feel free to drop your message in the recall section. Any question that you feel was not in the original form or was little distorted, that is very much possible, because again these are all recalls and recalls are having some fallacy, but this is the best kind of recall that we could try to collect the maximum data, and we have discussed with many students actually to come up with the best form of this question, right? So thank you very much to all of you guys. I'll see you around in the upcoming classes. Bye bye.